Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Causes of abnormal causes of abnormal uterine bleeding depending on different age groups. Menarche. Menarche is puberty menorrhagia. If there is abnormal uterine bleeding at menarche, then it is called as puberty menorrhagia. Puberty menorrhagia can be an ovulatory bleeding, coagulopathy. In coagulopathy, it is due to the history of heavy bleed. Always suspect coagulopathy if the patient has history of heavy bleeding since menarche, or if the patient has heavy bleeding with tooth extraction. Infection can also result in puberty menorrhagia. If adolescent female is sexually active, then there can be pregnancy complications.
If adolescent female is active sexually, then always think of pregnancy related complications.
Abnormal uterine bleeding in reproductive age groups. Abnormal uterine bleeding in reproductive age groups. In reproductive age group, the patient may present with pregnancy related complications or polyps. Polyps show heavy bleeding at irregular intervals. In the polyps, there will be intermenstrual bleeding, that is bleeding in between the menstrual cycle also. The bleeding in polyps is not responsive to treatment. Third, adenomyosis. In adenomyosis, the patient presents with bleeding and dysmenorrhea also. Fourth, fibroids. Fibroids is usually a coincidental finding on transvaginal ultrasonography. Fibroids is seen in reproductive age group. 5. Hormonal complications. 6. Infections. 7. Endocrine disorders. Abnormal uterine bleeding in perimenopausal age group. That is, abnormal uterine bleeding in perimenopausal age group. In perimenopausal age group, there can be pregnancy complications and ovulatory cycles. There can be benign uterine neoplasia or endometrial hyperplasia. The fourth, abnormal uterine bleeding in postmenopausal age group. In postmenopausal age group, the most common cause of abnormal uterine bleeding is endometrial atrophy or senile endometritis. Hormone replacement therapy. Only in 10% of cases there is endometrial carcinoma. In India, cervical carcinoma is also seen in postmenopausal age group.
thank you and thank you for watching.